set, helped by 15 unforced errors from Alcaraz. But the Spaniard recalibrated to win 3-6, 6-3, 6-4 and set up a title showdown later today with former Tokyo champion Taylor Fritz. Meanwhile in Beijing, Jannik Sinner is into the China Open semi-finals after beating Hungary's Fabian Morozan 6-1, 7-5. He will face Alex de Minaur, who leads 10-0 head-to-head. Sinner, who made
Well, good morning,
Glenn, Angel, and Tim.
Good morning.
Good morning.
Well, good morning.
It's a beautiful day, isn't it?
The Big Show on Kiss 92.
Good morning. Good morning.
Good morning, Singapore, and welcome to the Big Show. It's Glenn, Angel, Tim, and Dr. Geraldine time from the therapy room. Unfortunately, this is going to be the last time that we're going to be
Therapy Tuesdays.
last time
Yeah.
for Therapy Tuesday. But you will be back from time to time, I guess.
When you invite me.
Yeah,
Okay.
you know what? The invitation is always open, Dr. Gerry. I mean, as much as if we see there is something that needs to be spoken about, maybe in the news or something trending, you can also let
Okay.
us know if there is something trending in terms of,
Definitely. Yeah.
labels and whatnot that people are, going through.
One of my friends, Adam, are you tuned in right now?
morning.
You know, he loves it when you come on Therapy Tuesday, so he's going to miss you.
I must thank everyone also, so some of them actually came by and took photo with me in my center.
Oh, wow,
So very
okay.
grateful. And David give big shout out because every week he does the poster. So
That
if
is
you
true.
see the poster is his poster and he's like, I'm gonna miss you.
Please do not stalk Dr. Gerry at her office, okay? If you
Let's just slip into her DMs.
if you want to give her any messages or anything, you can drop it right now on our Facebook and YouTube channels. Any good wishes that you want to say to Dr. Gerry.
I'm dying.
Good wishes.
No. Well wishes.
Okay.
Don't write anything. She doesn't want to.
I'm not going to say anything. I'm not going to say goodbye or whatever because, she's going to be around.
Yeah.
If you want to meet up with Jerry, just give her a call. That's all. The number is...
Ayo, all coming out now.
It's
Okay.
just for us. It's just for us. So today, what are we going to be talking about for your last show on The Big Show?
Well, it's a little bit of a summary, a little bit of a roundup. With therapeutic sessions, we always need a little bit of a summary and a roundup, right? So this is what it is, And we had been talking about all the different clinical disorders. So maybe a little recap today would be very nice. What is, the tools that we use. So the books that we use, the psychologists use the DSM. So it's the Diagnostic and Statistical Manual of Mental Disorders. We are in our 5th edition already. The doctors use the ICD, which stands for International Classification of Diseases. So they use a slightly different manual, and they are in the 11th edition
Okay.
already.
Wow, okay.
All right, let's continue to talk to Jerry on The Big Show TV. Meantime, here's Lizzo with Still Bad on Kiss 92.
Joyce says Therapy Tuesday is my favorite Big Show TV. I've learned a lot about psychology through this session. Definitely will miss it. And Jeremy says good wishes from Jeremy, Joel, George, and Joel.
Okay.
He wrote that, the two Joels.
Lots of Joels.
Joel and George.
Yeah.
So they're all sending through their
Oh,
hellos.
big love, and I think I really want to thank everyone. So the last weekend was, I don't know what to say about the last weekend. So the 2 awards, Friday it was the influencer award. I don't know how I really the nomination, yes, but then, I thank the judges and I thank everybody that give me that love, It's like, okay, I'll continue to do and work harder.
What was that
deserved,
about? What was that about? The influencer award. I mean, I kind of saw a post.
Yeah, the influencer and then the Singapore Silent Heroes, and that
right,
one was
Singapore
quite overwhelming. I was like, oh my god, it was so good.
Okay, I have to ask you, influencer award, right? Because
Yeah.
nowadays that word very taboo, right?
Yeah,
Do you
yeah,
mind being called an influencer?
And I don't even think I am an influencer, but if I make an impact in any way, I would take it.
I think you are an influencer.
Yeah.
Why
You're
is influencer taboo?
No,
Because they don't like that word. They went from
KOL.
influencer to key opinion leader. Now it just must be content creator.
Yeah, but I think Dr. Gerry is the most authentic influencer that's actually giving out good advice that helps people.
Aw,
and
so
you inspire
sweet.
people. No, but that's the true influence of your work.
okay, impact. We want to.
We can't call you an impactor. We'll call you an influencer.
Also, I mean, being on the radio show every week
Yes.
also kind of helps, right? Because I mean,
Of course.
I mean, you're obviously like in your office and
Yeah.
talking to your clients and all
Yes.
that. But I think this platform has given you a little bit more because you've gone out there a little bit more, and
Yes.
people
Absolutely.
have heard of you and seen you.
Yeah, and I'm very, very grateful. Grateful, for yes, the vain me will say yes, it's me, but then the community benefits so much, and you're really just condone whatever that I.
How many
bring
years
to
have
the
you been on
table.
the show already?
Yeah,
5, is
later
it?
we do a
Is it 5?
trivia, okay?
Oh.
Roughly?
We'll do
She want to
trivia.
test you. She know the answer.
I
You
just
want
tell
to
you
know.
first, $100,000 for every year that you've been on the show.
To
give us.
Oh, to give us. I thought you were going to give her. Okay,
Oh,
to
you
give
give
us.
her?
All right. all
Why
right.
you don't give me?
I'll take it.
Yeah, but yes, I think it was a really awesome thing that you started, and then it just snowballed into something that people enjoyed.
Something
She was
amazing.
always our first choice, by the way.
Of course. I mean, who else would there be, right? But today we're talking about
Yes.
all the different clinical
Clinical
disorders.
disorders.
Now, obviously, I only just joined the show
Yes.
recently,
Yes,
so I've missed
yes,
out
yes.
on the majority of such clinical disorders
Yep.
that have been covered in the show.
Yep.
Since the dawn of time. Okay, what are some of the ones? I'm going to ask my co-host first that they remember the big ones.
Oh,
Okay, let's go with the different
sex
developmental.
addiction.
Oh man.
I knew it was going to come up.
I was gonna contain it and go with like the different developmental age group.
Oh,
yeah,
wow.
yeah,
Okay,
yeah.
you do it your way. Today's your last
okay.
show anyway.
No, it's
You've
okay.
got everything
okay. So
organized
this
and
one
planned out.
Tim can answer. So developmental stages. Let's start from the young one. So last week, what did we talk about?
Impulse control.
Impulse control, but I mentioned 2 for the young ones. And the ones that you were trying to
Oh.
think of the acronym.
Thank goodness I wasn't around last week. I don't remember any of this.
ODD and CD.
Okay. ODD was the oppositional
Oppositional.
Distractive.
destructive
Oh no.
disorder.
Defragment.
Defiant disorder.
Defiant, that's right.
Defiant, yes.
And conduct disorder. Then we have the autism spectrum disorder. We have the global developmental delay, just to name some of it. And we have spoken about some of these disorders on the show also. Yeah, and then we have the learning disorders.
Older. Slightly older. Learning disorder. Come on.
Just point.
She says here is the perfect example.
Learning disorders, like ADHD. is,
Dyslexia.
Dyslexia, learning specific learning disorder. So it's classified under specific learning
learning
disorder.
because she's
Yeah.
diagnosed me as having ADHD. That's why.
ADHD is attention deficit hyperactivity disorder.
Definitely, Glenn.
Just point this direction.
But today I'm okay. Right, today. Maybe it's one of those.
Did you take your
one of
meds?
those-
Yeah.
Not supposed to take my meds before the show.
Oh, Glenn.
Then you
naughty
don't get
boy.
the best of me, you see.
Oh my goodness. And then we did talk about some mood disorders. So what are some mood disorders?
Depression?
Depression,
Anxiety.
anxiety, panic disorder. So these are some mood disorders. We spoke about personality disorders, schizophrenia. We didn't really talk about schizophrenia, but we did talk about adolescence, the Netflix show.
Yeah,
and So
what a lousy show that was. Okay, we're going back on it.
Kiss 92 traffic.
Just the usual peak hour traffic, so pay attention if you're on the SLE towards the CTE, on the PIE in both directions towards Changi and Tuas, and on the AYE as well as the KJE. If you spot anything specific that's holding you up, you can always WhatsApp us 88550920.
Welcome back to The Big Show on The Big Show TV. It's Therapy Tuesday with Dr. Geraldine Tan from the Therapy Room.
Yay! And we spoke about the different disorders at the for the different developmental age group. And
How can anyone look so happy speaking about all these, developmental issues?
I'm educating people. How can I not be happy?
Maybe
And we're very proud. She's very proud of all the different things she's covered over the years here on the Big Show.
Okay.
And you helped me to cover, you helped all of us to cover that. Yeah, so we had the childhood issues, ASD, ODD, learning disorders, ADHD, SLD, specific learning disorder, mood disorders, depression, anxiety, and then we have other clinical issues like the eating disorders, schizophrenia.
And that one that got me really upset a couple of weeks ago.
Munchausen syndrome.
Yeah, the one where
Yeah.
the parents abuse their children just to foster dependency, right?
Yeah.
I think I traumatized
Yeah, you
him.
did. You did. He's never been the same.
Still recovering. I'm going to have to see you for treatment soon.
Okay. We did cover fun things like that, really, really needed. I mean, it is needed to cover these topics, but also other interesting ones like Pika. So Pika was the one that they eat, random things that are not food.
I don't
I don't remember
that.
this. I would love to have been there. Can you recap? What does that mean?
I
It
definitely
was
don't remember
under
that.
eating disorders.
No, did we really talk about
Yes,
that?
we did. We did talk
Oh.
about Pika.
Okay, could you
But
just
it was
recap? What is Pika again?
Pika is where they eat things that are not food. So just pick up random things.
Oh.
Yeah.
What does Pika stand for?
It's not. It doesn't.
Oh,
stand
it's
for
not an
anything.
acronym.
No,
Okay.
PICA.
PICA.
So
Yeah,
you literally just
PICA.
Pika it off the floor and put it in your mouth.
For some of
Pika?
the kids,
Yeah,
yes.
okay.
But you hear of stories like some people eat like nails, so they eat glass. Yeah.
I've heard. I had.
Usually possessed people
Oh.
do that.
Look at his
They need
face.
an exorcist.
Oh no.
Topic for a different day.
Yeah.
Halloween coming up soon.
Yeah. And I think this was a very, very safe space. This is a very safe space where we spoke at length about suicide. And I think I really, really appreciate. So big shout out to Yongle's parents. I think if we recall, I read part of his letter. Yeah, Mummy's letter. Yeah, so I'm very glad that they are speaking out and to share, and that pain. I don't think they will recover from the pain, but let us ensure that another life is not lost.
And you do something on Mondays, right?
Yes.
For parents who have lost children.
Yes.
Maybe you want to talk about
so,
that?
So Healing Hearts is for mothers only who have lost children to suicide.
Okay.
Yeah, and that runs on Zoom every third Monday of the month.
Okay. All right. So if you
Yeah,
need anything,
yeah.
they can get in touch with you.
Yes,
All right.
yes, and that one is free. So it's our community give back. So
Okay.
that one is free. Yeah, all others you pay. Okay, no, I'm just kidding.
You have something on every day, quite frankly. Monday that, Tuesday this, and then later you're going to do something else.
Yeah. I'm going National Library Board for the seniors. We're going to have an escape room style activity. So
Work
that's
with
why
the
I'm in
young
my
people,
tea.
work with the old people. What about the people in the middle? Okay, we'll continue to talk about this on the Big Show TV. It's 8:17.
Kiss 92 Time Check brought
I mean, not just people. She works with animals as well. The horses and
The dogs.
the
Remember, we had the dogs that
yeah.
come on.
The golden retrievers
we
that
had
came
so
in.
Yeah,
much
but you don't
issue.
you have friends there, like you don't necessarily work with
Oh
the
no,
dogs
I don't work
and
with
the,
the dogs
and the horses.
Yeah.
Yeah.
Yeah, but we know that can be used for therapy, which is lovely.
Lots of different ways. You know, I just want to.
Yeah.
You were talking about healing hearts. Why is it, if I may ask, just for the mothers?
The mothers actually requested because mothers and fathers grieve very differently.
What are the differences?
So moms tend to be more expressive. Dads sometimes are very quiet about their grief, and they bury themselves into work. They do other things, or they don't. They don't know how to talk about it, or they find it difficult to express it. So they express it differently. So they don't express it in words.
Would you ever allow like men to be in that session, or is there going to be something for the dads on their own?
So I don't know if dads have their own support group, but SOS have support groups for both males and females, and you have child bereavement support that have both parents there, and then you have Piata, who also have both parents there.
Okay.
Yeah. So there are a lot of support groups out there.
Okay.
So mine is just exclusively for the mothers, just because they want to share that space and that community with each other.
Jen says today it feels like a second time the sad mood that we're going through a sad moment because the first time was when FD left. Thanks, Dr. Gerry, for being our almost weekly
Who was
therapist. Jen.
When FD left.
Jen.
Oh, only you, Jen.
Jen. Yeah.
Ayo!
Thank you, Dr. Gerry, for being our almost weekly therapist. I share certain topics with my kids over dinner, and they're informed and inspired at times, so I'll definitely miss you and these sessions. Judy says
Cannot
the
make
same.
me cry, okay? I'm overcompensating by laughing a lot today. If you all don't realize
No,
that, right?
I'm a psychologist, so I already got all the Kleenex
Tissues ready, yeah.
ready.
Oh no.
That's why today
Wow, tissue suddenly appear out of nowhere.
I'm also like that because
Oh.
Christopher says, good morning, Dr. Gerry. We'll miss your laughter and advice. CY says, all good things must come to an end. Thanks, Dr. Gerry. Maul says, I also don't recall about Pika. Maybe you didn't talk about it.
she did. Now I remember.
now you do.
I thought maybe she spoke about it on another radio show.
No.
Jerry is exclusive to us.
Now I'm out there, huh?
Now she's going to look.
But you will never have as much fun, I promise you.
That's true.
Yeah. She's looking to see when she did Pika.
Yeah.
No need. It's okay. Okay, let's continue.
Yeah,
with
we
today.
believe you. We believe you.
Okay.
Dr. Gerry, if I could just take you back to something you mentioned, and you probably covered this when you were talking about grief, okay?
Yes.
Obviously, I wasn't around, so I would like to know this. When you mentioned that there are differences between how men cope with grief and how women cope with grief,
Yeah.
men sometimes keep it in. I have heard, and this is what has been told to me, at least from friends who don't like to talk about their issues, is that by talking about their grief, they're reliving the moment over and over again.
Yes.
And rather than make them feel better, it
Yeah.
actually makes them feel stuck in the same situation, reliving it over and over and over again. What would you say to that?
Okay, yeah. So that is true for some people where they feel like when we talk about it, we re-traumatize because we go through that image all over again. So that's why in therapy, we work with you and journey with you to process. So process is a journey, right? So you need to walk out of it. Otherwise, it's very circular. So if you think about it and if you talk about it, and if you talk about it in a circular fashion, you spiral down even more, and you keep rehashing, or you keep reopening the same wound, and it gets deeper and deeper. Yeah, so absolutely right. So it's not wrong. Yeah,
And this tends to affect people who are overthinkers.
they do, because it's all in their head, and they would need to substantiate whatever that is going on in their head. So they pull a lot of different associations to substantiate, but that makes the event or the situation even heavier. It doesn't make it lighter. Yeah.
So remember, go see a psychologist if you're an overthinker and it's like overwhelming.
A therapist, so a counselor. There's so many different
Counselors? No lah. Must be a psychologist.
Do you think everyone needs a therapist?
I would say, so this is what I advocate for, and I'll repeat it today. Go twice a year. You go for your dental checkups, right? Twice a year.
4 times.
So four times. Some people 4 times also can. So you go for your mental health checkup twice a year, or 4 times if you like.
Oh, I've already gone to Gerry and her therapist. I think maybe about 8 times already. I think.
This year?
Yeah.
No. Oh wow. Okay.
I mean, not this year.
Not this year. Since you started.
Yeah, which was a little bit last year and this year. Yeah. Hey, but now that you're not going to be on the show already.
No.
Cannot.
Come
She has a
on.
personal relationship. Cannot.
I mean, although I have my therapist, but after a while, I want to move on to another. I like a variety.
Glenn gets bored very
Come on,
easily.
Jerry.
No. So he's tried from the first session. It's like.
So why?
I text your husband. Ask your husband convince you.
Question.
To see
Why
me.
would you not see him?
Okay, so we don't see our friends or our family relatives, because of that emotional sort of investment in the relationship itself, which may then lead us not to be very objective when we deal with the situations.
And you also wouldn't be able to gossip about them, but like if you did.
I don't think
Did you know what
No.
Glenn told me?
So what would it take? What would it take for you to be willing to see Glenn as a client? Would you have to stop being friends?
Yeah, I think so.
Undo the 5 years
No,
that she's been on the
but
show.
then there would be history.
Yeah.
So I would not do that. Either.
And there's prejudgment already, I feel, right?
Yeah,
I mean,
yeah. So we are all human beings.
Yeah.
Yeah.
She already knows everything
She
about
knows,
him.
yeah, exactly. She knows.
That's why she doesn't want to see you
she
as
knows
well.
my character.
She's like,
Because secretly she judges you.
Yes.
Prejudgment.
No, I don't. I
can you
try
imagine-
not to.
Can you imagine how fun it'll be if you're my therapist?
No, I can be your friend, and it will still be.
still be
fun.
the same. That's
Yeah.
true. You can
Yeah.
go for a drink with her, not pay her,
Okay.
and still get therapy.
Okay.
How's that?
But you may not get the objective,
Oh my goodness.
the objective treatment.
Yeah, because I don't think I just like to talk to a professional. Because, sometimes when you talk to your friends, it's not the same, you know what I mean? So I think I get what Gerry means. If we are friends, then when we
My
talk,
language will be different.
it's different. But if you talk to
Yeah.
an expert on certain things, that person will then be very objective
Neutral, yeah.
and neutral. Yeah.
Yeah.
Later on, I'm going to talk about 3 different cases. 3 cases that I constantly bring, into our session, and 2 of them we've actually seen them on air also. Ashwin and Samuel.
Oh, Samuel the photographer.
Yes,
okay.
yes. So we'll
With
talk
him,
about
yeah.
it because we want to tie up. We want to let the listeners know and the viewers know where they are at in their lives.
Oh,
When
I
was the
haven't
last
heard
time we
from
spoke
Samuel.
to
Yeah.
them? I mean, I think it was at least like 2 years ago, right?
At
Ping
least.
Hui just talked to Samuel.
Oh, is it?
Yes, he got him on the podcast.
Oh, Ping Hui's got a podcast now.
Now you know.
I play golf with him. He never mentioned
Was I
anything.
not supposed to say
Because he doesn't want you to judge. That's what it is.
That's the first thing he's going to do now.
Okay, come. Traffic.
Blinded by the lights. No, I can't sleep until I feel your touch.
Kiss 92 traffic.
On the AYE towards Tuas before Clementi Road, a vehicle has broken down. Also on the PIE towards Changi at Lornie Highways exit, another vehicle is having trouble there. Same situation on the SLE towards the CTE. A vehicle's broken down before Mandai Avenue. Stay safe.
Welcome back to The Big Show on The Big Show TV. It's Dr. Gerry's last show on The Big Show. I'm going to miss that pretty face thing on The Big Show TV.
Stop staring at the screen.
Okay, all right. Okay, Dr. Geraldine Tan, multiple award-winning psychologist from the therapy room. Congratulations on your latest 2 awards, by the way. Your Influencer Award as well as your Silent Hero Award.
Yeah, it's so funny. I'm not silent at all, but I understand. But I understand what it means, right? When I was there, when I saw the love from everybody, all of them are our silent heroes. I just make too much noise.
Well, a majority of that noise is your laughter, which Tony has actually described as infectious and genuine.
Yeah. We've got a lot of people that are commenting on YouTube as well as
I'm
Facebook.
sure some people also cringe at your laugh.
I know, right? Like,
I'm just saying. I'm just trying to balance things out a little bit.
Yeah, of course. I mean,
Okay, but we love.
Dr. Gerry, part of the services you offer, sensitivity training, Gardner. I feel like this is something that maybe he should go for.
She's used to it already. I need to give her a dose of me.
empathy and compassion. That's what he needs.
He actually has a lot of empathy.
He does. He just has this wall in front of him that he tries to put up. You're not fooling us.
No, not at all. Okay, anyway.
Yeah, so we have all our different personalities, but we have certain personalities that I want to share because, this recovery journey for all these clinical disorders, we hope that it's fast, but sometimes it's not one session or two sessions and then it's done. Sometimes it does take years. So these are the people that permit me to talk about their disorders, to share that it is a journey. So one of the clients that I have, and the client says, you can share everything, just don't share my name and what too much details, but you can share about the disorder. And the client has depression, very, very complex depression, and first diagnosed in 2005.
Oh wow.
So 20 years ago. And I met client in 2006 at the hospital. And I've been seeing clients until now.
Wow, for 19 years.
Yes.
And does clients still have depression after so long?
So managing, that's why there is hope in recovery.
Wow.
Yeah. So definitely dealing with the career, managed to hold down the career, dealing with it absolutely well, went through bouts of grief. But having that support network, I think this was something that client allowed me to say that countless times I had to throw into the hospital, where we needed to keep clients safe.
So there are times when people do not get over depression. And they just live with it.
Yes.
Wow.
Yes.
They have good days and bad days, right?
Yes.
Oh my.
Cocktail of medication, the support system, the lifestyle, the consistency of therapy. Yeah.
That must be so painful.
Yeah.
I have a shot of Johnny Walker Blue Label every day. I think that helps, no?
I think clients are off alcohol.
You see, I think alcohol is a very misunderstood beverage.
It works for some people.
Yeah, correct. That's why you don't overdo it. But it's enjoyable in small doses.
As he says, don't overdo it.
I think it's healthier
Small is subjective.
I think it's healthier than medication, don't you think?
Yeah.
No, okay. All right then. We're going to be talking about politically correct and incorrect terms, I feel, because I think many people are using the wrong terms when it comes to people with psychological disorders and stuff. Maybe we can touch on that as well. Certainly something like short circuit should not be used. Anyway, we'll be back shortly. Let's continue to talk to Gerry on The Big Show TV.
Glenn, Angel and T.
Where did that come from?
Wow. Okay.
A movie, isn't it?
I think so. Absolutely. Yes. From back in the 80s. I just want to touch on depression. Okay. Now, yes, we know sometimes it can take years, months, years.
Yes.
So two-part question.
Yes.
Number one, what is the longest you've ever seen it take for someone to get over the depression? And number two, just because you've gotten over it, could you get a relapse?
Yes. So short answer, yes, you can get a relapse. So this particular client, we've journeyed for 19 years now, diagnosed for 20 years, and still ongoing. And my suspicion is it will still continue as long as we need to manage the disorder. Yeah. So I mean, there are those that they have, they said, crawled out of the hole of, the blanket has lifted and they feel much better. But to your point, right, will there be a possibility of a relapse later on? Yes, there is. Yeah, and some of them come back after they have a relapse also. Nothing to do with their triggers or their lifestyle, or that they have not gone for therapy, or that the therapy is not working. Sometimes it's a hiatus of like 10 years and then the depression hits again.
I know it's probably one question too many, but what has happened for someone to be so depressed for so long? Is it triggers different people differently? Is it a loss? Is it
is it accumulation of different things?
What happens?
It's a lack of purpose as well.
What kind of trauma
Once
can
you
happen?
feel like
Purpose
there's
is
no
one
purpose.
of the method that we use, to help them to manage depression. It doesn't have to be. It can be a
Anything.
chemical, biological,
Yeah.
genetics.
Right. Yeah. Okay.
Yeah,
But it's very,
yes,
it's very scary. I mean, you mentioning depression. I have to say, out of all the conditions, when someone mentions depression, I get a bit serious, because I think about all the people, right, who feel depressed on a daily basis and
Yeah.
cannot get out of it,
Yeah.
right?
Yep. Yep.
It is a scary thought.
It's lonely. It's
It's
very
like you're
lonely.
sad
It is,
all the
it
time. It's
is.
like you're sad all the time, isn't it?
Yes.
Right?
So
Can you
you're
imagine
locked in a
being
dark room.
sad all the
But
time?
not just sad like there's no hope sad.
Yeah.
You know what I mean? Like
Yeah,
it's the end
yeah.
of the world
and they
sad.
can't help it.
Yeah.
It is so scary.
Yeah.
And the worst thing to do is like to say, get over it, or this will pass,
Yeah.
or whatever it is,
no,
because it
no.
doesn't.
Yep.
No,
Do they get used to it?
Oh,
you never get
You never
used
get used to depression, where you just think,
Yeah.
my life is just like that. And so, you know what I mean?
Yeah.
What I'm trying to say is, like, sometimes when things are so bad, and this is a very sad thing to say, you kind of you think this is your life. You know what I mean?
this is what you're destined for.
Exactly. It's when you focus on, the good times, then you have that contrast and you feel miserable.
No, which is why
right?
it's so important, right, that we've had Gerry on the show for so long, because it's to remind people to seek help if they need help. Like some people who have clinical depression, they do need medication, don't they? So they won't see someone like Gerry. They'll see a proper
Psychiatrist.
like a doctor, a psychiatrist.
Yeah, a psychiatrist.
To
get
get
medication.
help. But this show serves as a reminder to anyone who has friends, who are suffering from certain conditions and all that, to remind their friends who may not be listening to us to go and get help
Yes.
before it's too late, right?
Yes.
Yeah.
So I just want to pick up on what Tim mentioned. So resignation, we don't want to go that direction. We want to look at acceptance, and acceptance is not resignation. It's actually very different. So when you accept your disorder, you then learn how to manage your disorder. You don't sink into resignation and not do anything about it.
I mean, I know someone who has depression, and even trying to think of all the good times, that
No,
the
cannot.
good times
Yeah.
do not overcome the bad times, you
Yeah.
know? Like they feel so alone, and there is absolutely no hope. There's nothing that can be done. And can you just imagine waking up? I mean, we wake up on the right side of the bed most of the time, but to wake up and feel so heavy all the
Yeah.
time, it must be awful.
Yep.
I know. I think
Must
we
be
are,
so bad.
and that's why I think going forward, right, we should not be such a repressed society. I feel like in the
Yeah.
past, we always hold our feelings in. We don't
Yeah.
express ourselves. The only way is to express
Yeah.
yourself.
Yeah.
Yeah.
But not in a circular fashion.
Not in the
And not in
circular-
a negative
Share
way.
it with someone.
Yeah.
Share it with someone.
Don't be angry or whatever, but at least share, be open
Yeah.
to talking about things,
Yeah.
to communicating.
Can I ask, because we do see things like crime happening, and sometimes we think to ourselves, okay, this person must be very angry or depressed or sad or whatever, but it's a negative action,
emotion,
right?
yeah.
Negative emotion. If people can express themselves negatively so overtly by saying, stabbing someone or stealing something or whatever it is, an accident or whatever it is, why can't they do the same with a positive attitude? Like Glenn is saying, don't be so repressed. But the anger is being shown, so
Right.
they're not repressing that anger. Why don't they also show the good side, the happiness? Is that a lot harder?
To be
Positive.
overt about the happiness. Actually, we are a very restrained society. You know, there's a lot of limitations on us. So I appreciate many of you who enjoy my laughter, but like what Glenn says, many people actually don't like it. Growing up,
You know, people have told you.
yes. So
Are you
I'm
serious?
just about to say, you know, growing up, everybody is saying like, "Shut up, Jerry." You know, it is you're so uncouth or you're so immature. Grow up. So this is what I hear, right? But then I hear Angel saying, "Oh, very authentic." Then I go, yeah, I hear you, but I'm not sure if I can believe you because I've been
All those
taught,
voices, yeah.
yeah, that it is not right, you know. So the explosive laughter sometimes cannot control, right? It bubbles and then it pops, right?
Let it pop
sometimes
like
you can
champagne.
But sometimes you can tell when someone is sincere and whether someone is just saying
It
it for
is,
the sake
it
of saying.
is,
Like I
yeah.
look at you right now, I think you're quite chill.
Oh,
She believes me straight away.
Where did that come from? Tim is like, let's move on.
Quite the
yes,
chill boo.
let's move on
Okay.
to the next two. but yeah, unspoken disorders.
Jerry,
and-
Shine is asking you to keep quiet.
So once again, sensitivity training. Like, how many courses would we need?
Poor Cheyenne's face.
lifetime subscription for Glenn.
Okay, we'll continue from there when we go on there, okay?
Yeah.
Kiss 92 traffic.
On the SLE towards the BKE, a broken down vehicle before Upper Thompson Road. Also on the PIE towards Changi at Lornie Highway's exit, a vehicle has broken down there. Finally, on the AYE towards Tuas, another vehicle having trouble before Clementi Road. If you spot anything else, our number is 8855 0920.
You know, we just played a song by Ray. The title of that song was "Where Is My Husband?"
Ayo.
Oh my goodness.
Oh my God, that's a new one. That's a new one. "Where Is My Husband?" by Ray. Wow.
Well,
Anyway.
number one, does your husband like your laugh? We were just talking about Dr. Gerry's laughter.
Yes, I mean he has no choice.
Okay. All right. I think at the end of the day, a world full of bad laughter is still better than a world with no laughter.
This is true.
Okay.
And there's no such thing as bad laughter.
Yeah.
You know, it's a positive thing for people to laugh.
Yes.
Except that one. Yeah.
So even that one, I mean, seriously, never be ashamed of your laugh.
Yes,
I think.
exactly. I agree.
Yeah, thank you for embracing that. And we want to embrace the young ones that came on the show. So there's young Ashwin. Ashwin is now 14 years old. He has been with me since he was 4 years old. When I remember the time when I held his hand in kindergarten because the school didn't know how to manage him. So we went into the school and really worked with the school. And he's still in a mainstream school.
Oh, amazing. Well done,
And he's
Ashwin.
now a teenager.
Well done, Ashwin.
Well done.
Yeah, so
An
it's
angsty teenager?
he is developing and he's learning different things. I'm not quite yet because they develop differently. Their brains develop differently, so the emotions are displayed slightly different from the mainstream teens. But yeah, he is curious about girls also.
There you go.
Nice.
So it's normal. He
Oh
must
my
be a
God,
bit
I-
angsty as well, because then that's a normal teen. You know what I mean? If
Emo,
the person is,
angsty.
yeah.
Going through their Cure or My Chemical Romance
Correct.
phase.
If
But
you're-
he is such a sweet boy. Such a sweet boy. Yeah.
I don't think we use the
You
word
can be
normal
angsty,
and
you
not-
can love like girls and still be sweet. Why not?
Of course, yeah. I didn't say anything.
Yeah.
yeah. But kudos to his mom who never gave up.
Amazing. Well
yeah,
done.
a lot of patience, a lot of love, a lot of trust in the people. I mean, she would curate her team, her care team, right? And there's a lot of trust in her care team.
I'm sorry, I don't know if you said, but what is Ashwin living with? Is it autism? Autism. Okay.
Yeah.
all right.
So he's on the ASD, autism spectrum disorder.
Okay.
Yeah.
All right. Okay.
Yeah. Yeah, so he came on the show. I think if we recall, he was at my center because it was more familiar, and he was kind of like walking around. But he came and he shared a little bit. Yeah.
Yes.
Shall we end up the show in just a while with that song, The Greatest Love of All? Like, I'll go, I believe the children are our future. And then, Jerry?
Teach them well and let them lead the way.
Okay, never mind. We'll arrange...
Karaoke session.
and we'll arrange a video with Jerry.
Oh, music video.
Yeah.
Ayo.
Music video. I was
She-
just telling the team,
she
I'm
can
like, I think
dance.
from now on
Oh.
we want to release more music videos because that's what the Kiss 92 fan, at least of the big show, that's what they want.
Can.
More of us singing. Okay. Yes, we'll come back with more of Dr. Gerry in just a while. Meantime, here's Zara Larson with Can't Tame Her. Who are we talking about here?
You.
On Kiss 92. Today we're going all the way with Dr. Gerry a little bit longer.
Really?
Since it's your
I was
last
like,
show.
oh my gosh, it's
Don't
going to
worry about it.
end.
Usually
Don't
we
worry about
end
it.
like right now, But then I think we'll just have
Okay.
about 5
I know
minutes more
the
of you.
trivia. So yes, I did say I wanted to talk about Samuel, and Samuel did a deep brain surgery, deep brain
When?
stimulation. So last year, beginning of the year, and his tics have decreased significantly.
Oh, amazing.
Yeah. So he came back. He gave the warmest hug.
I haven't seen Sam in a while. I hired him a couple of times to take photos of me at my
Yeah.
events.
Ah,
Yeah,
okay.
I have not touched base
So
with him.
he has always lived with Tourette's, and it was really, really bad at one point. But now he is a huge advocate, talking about it. Yeah, but he's got a girlfriend.
I should drop him a message.
up.
Oh my
God.
gosh.
Yeah. Okay.
Amazing.
Okay, so Therapy Tuesday trivia.
Let's
Okay.
go.
With
Is
triple
this a-
T.
Here,
You get the bell too.
I don't. Okay.
if we are right. You
This is
Okay.
a contest now.
Okay.
Yeah. Oh, we love
yeah.
we love contests.
Cannot.
No,
see
I'm not.
answers.
My eyesight is not
When
that good.
it was the first session.
Wow.
2000 must be the date. or-
2000.
Oh my God.
Date.
Okay.
Date
2020.
2020. Yes.
Yes.
Oh.
January 2020.
Not January 2020.
February 2020.
No.
March 2020.
December 2020.
Remember that circuit breaker was in
Wow.
April
June.
6th.
I really don't
yes,
remember.
April
Yeah.
6th.
April 2020.
No,
April 6, 2020.
May 2020.
Andre at that time had to go and canvas for all the different guests.
Oh,
so we
I
cannot.
wasn't there.
May,
So
May 2020.
I
No.
got no
May the
excuse.
7th.
No.
I've got no excuses
Is it in
because I
May?
wasn't there.
June
No.
2020.
June 16th of June.
That was my
Just
next
before,
guess.
a few days before my
Your
birthday.
birthday.
16th of June.
Okay, so I get that one.
Okay.
Yes, 1 point for
Oh,
me.
he own self-cooked himself.
Sorry.
Okay. How many sessions have we had thus far?
Oh, right, no.
Wait. 53
Glenn.
weeks.
83.
Glenn.
Oh, yes. Go.
200
24,
plus
25.
200 and
25 times.
250 260
Close.
250.
Is it higher or lower? 299.
Wow.
No.
272.
200
Close.
and
260.
60.
Close. So 263, including today.
I win again. That's quite close. 2-0.
You can't be giving
Okay.
yourself the score.
2-0.
Okay.
How many producers have we had?
Oh,
Five.
Since this
Five.
show?
Sean.
Four.
Sean. There was Sean. There was
Andre.
Anjali. Andre. Oh,
You
not
can't
say
call
seven.
Anjali.
not
He's in
say
love with Anjali.
six.
Yeah, I am.
No.
I completely forgot
Andre.
about Anjali already. Andre, Sean, Cheyenne, and Shalini.
Yeah.
That's it. Four.
Yes.
That's why I said 4.
3-0.
You said five.
3-0. You said 5-3.
Okay.
I vote for a recount.
I vote for new questions.
Some more?
Okay.
That's it.
Which country have we traveled to? Therapy Tuesday have gone.
Japan, Korea, France, I think.
No, I don't think France.
Not
No,
France.
you know,
No.
Switzerland or one of those. Germany.
Nope.
No?
No.
No?
Korea.
Korea,
Korea said
Japan.
already.
Oh, Japan.
I remember Japan.
Malaysia.
Malaysia, definitely.
You've done Europe somewhere, but I can't remember where. Was it the UK?
Italy.
Yes.
Italy. Yeah.
No.
UK she's done.
London.
London. You've not done the States. Indonesia? Have you done Indonesia?
No.
You were in Thailand though. Phuket. I
Thailand,
think you were in
yes,
Phuket.
yes,
She
yes,
was on
yes.
holiday, remember?
Yes.
Yeah.
Madrid. Tokyo.
But that's not really a question. So many answers.
Well, she's asking.
Yeah.
Okay, first topic that we ever talked about.
That one I can't do because I wasn't.
Oh.
Me too.
No.
Only Glenn can answer this.
No, that's the topic he wished was the first topic.
I always have to request, then she'll bring it up. Okay,
Psychology.
first topic.
Yeah, well, psychology. It was a very
The term.
interesting topic.
Generic,
because,
right?
Yeah. It was a very interesting topic that I wouldn't have chosen.
It
but
wasn't
was,
depressed. It wasn't depressing. Like, it was fun.
No, it was an interesting
I don't
one.
remember.
Toxic colleagues.
Toxic colleagues. Wow.
Hey, how do you remember this? Oh, so you really do
no.
record everything.
This one I remember. I
Toxic
think.
colleagues.
Yeah.
So did you Pauto? No, you were sharing toxic colleagues here. Then
No lah, I don't remember. I don't have toxic colleagues. What? I get along with everybody. Quite frankly.
come on, Dr. Jerry, you take notes. What did he say on the first episode? Who did he throw under the
That
bus?
one I really cannot remember.
Plus, the first episode, I think I wasn't like. Was I already so friendly with you already? The first.
You were
Or were we
professional.
all getting to know
Professional.
each other?
Was he calling you chill, asking you to talk about sex?
Wanting to get on your couch.
Couch, yes.
Couch.
Oh,
Yes.
and then at some point she told me that I visited her school.
Yes.
I was already
yes.
like a DJ at that time, and then she was a student.
Nanyang JC.
And she pulled out a photo of the both of us.
Oh, what kind of photo was it?
Me, she taking a photo with
His arm around her.
With,
Oh,
with
wow.
me.
Yes.
The arm was around. I cannot. No.
I'm joking.
He was very discreet.
Again, professional.
Discreet. I was very discreet.
What's this picking up on words? Okay, so we started during COVID. So COVID, we have all the care packs, right?
She's
So
brought us presents.
So I wanted to end with care packs also.
Always
yeah.
with sweeties.
Thank you.
Thank
Dr.
you.
Jerry.
Well, these are very different from the pack that we got from yesterday's therapist.
Yeah.
Yesterday we had a
We had a
orgasm dice.
We had a dice.
Today we
Wait.
get
Nobody
snacks.
knew that. We didn't talk about that on
No,
air,
we
did we?
didn't.
Oh, we didn't.
Well, now you know.
Okay, let's see now. What's this?
Mentaiko. What is this? Don Kibo? It's a biscuit?
Yeah, it's just a biscuit.
Nutella.
Oh, thank you, Dr. Jerry.
Okay, we're going back on the egg. Glenn.
Hey, is this Koyo
Glenn,
or what?
few seconds.
What is koyo?
No, this one.
It's a mask, a sheet mask.
Oh, I see.
Yes. Care pack, you see.
Lainey with Know You Naked right here on Kiss 92. All the great songs in one place. It's Glenn Angel, Tim, and Dr. Geraldine Tan from the therapy room. All right, Jerry.
Yes, and the care
it's almost
packs,
time for us to go.
Yes, I'm going to give little notes.
Oh.
These are from Singapore Kindness Movement. And do you know that jaberas are a display of a symbol of appreciation? So this is for Angel.
I know now.
Oh,
This is for Glenn.
I cannot read your handwriting.
She truly is a doctor.
You.
Thank you.
thanks for that little.
Okay,
that little kiss.
what's the first thing?
The rationality.
Oh, the rationality you bring and anchoring the boys. Hilarious yet so comforting. Thank you. Ah.
Yes.
you.
So we always
Can't read your
must
writing.
pay.
That's
You
what I
are a
said.
doctor. You are a real doctor.
We must pay forward. So inside all your care packs, there are a little note, the empty note.
I'm
that
gonna write one to you.
Okay, you
Glenn,
can.
you are provocative.
Okay. No. Come, I read yours. I read this out for you.
Yeah.
Okay?
Please do not
Okay. Okay. Dear Glenn, your provocative themes and words are the unspoken that need to be spoken. Thank you. From Jerry.
Really?
Yeah.
Oh,
Yes.
your repressed
Yes.
topic.
Yes.
Jerry.
What is mine? Dear Jim, Why your J? Why your J look like T? Like your T look like J? Okay. Short moments, yet sweet memories. And the feels you gave the topic of Munchausen syndrome was classic. Why you traumatize me again?
You'll never forget me like that, you know.
The day she made me so angry on radio.
Yeah, I know.
Everybody could see how your face changed.
He was angry. Yeah.
Well, I mean,
Wait,
that's testament to just how interesting a topic was
Yes,
that
but-
day. Yeah.
What about yours? You didn't read
I read
yours?
it.
I didn't read
I didn't hear.
The rationality you bring and anchoring the boys, hilarious yet so comforting. Thank you. Love, Gerry.
I've got one for FD. He was there for majority.
Oh,
of
can I read
our-
what FD says?
No.
Oh, no?
No, that one you can give him later. Why are we reading FD's?
Okay, I won't read it then. My goodness.
Yeah, exactly. Okay, you want to read, then you read. You read.
Right?
Because he's not on the team anymore.
Anyway, I'm very, very thankful for him because he always does the deeper, more reflective sort of space.
Because he didn't want to pay for his therapy sessions. That's why. So every week when you came in, you were his doctor. You didn't notice that, huh?
It's okay.
He didn't notice how he was
Don't
milking
be
you for
jelly
Oh my
now.
gosh.
Don't be jealous.
Okay.
It's okay. You're still important in my heart.
There you
Oh.
go.
Bro.
Yeah.
You still her favorite.
Thank
She
you.
don't let anybody else call her Chill on radio.
Many people have called it you already. Anyway,
Yes.
thank you very much
I'm
Thank
so
you, Dr.
glad to
Jerry.
be here.
Thank you.
for all these years
For all these
of
years, yes.
friendship.
It's
Yeah.
not goodbye. It's see you soon.
It's
We
see
will
you
chat
soon,
again.
yes.
Yeah.
But I do want to remind everybody. So I've got a Jerry's original quote. I don't think I said it before, but today I'll say, being emotionally resilient is a journey that doesn't stop with you or me. It starts with us.
Yay. Thank you, Dr. Gerry.
Okay, so we will give you a call when we.
Yes, of course.
When we need you.
Anytime.
Don't say anytime, no.
What are you
say
doing next-
anytime.
Oh!
I call you at 3 a.m. in the morning.
Be like, what are you doing next Tuesday?
I will text her.
Okay.
I will text her for everything. Okay, let's give Gerry a big hand.
Yay!
Thank you so much, Dr. Geraldine Tan.
I'm
For-
happy to
For all
be
of you
here.
who feel like you need someone to talk to, a psychologist or whatever, go look for Gerry and her team at the therapy room, okay? Thank you very much, Gerry.
Happy to be here.
Mwah.
Mwah.
Glen Angel.